All right, thanks, Alexis. It's Wellness Wednesday, and I'm here with Megan Timm. She's with SSM Health's Wisconsin Community Health Director, and she's here to talk about food insecurity and its impact. So, good morning.
Good morning.
We know how important food is, but how does food insecurity, and how does that impact the individual, the person?
Yeah, so food insecurity impacts all facets of life. I think that we often associate food insecurity to just like physical health outcomes, but really can impact our mental health as well. And I don't know if we often make that connection from across the lifespan. So from kiddos and how they can perform at school to our seniors and mental health decline if they are in fact food insecure.
Well, what is the connection?
Yeah, so there's a lot of factors I think that impact how food insecurity can impact mental health in particular, right? So senior isolation, we've seen a lot of that with the pandemic. We have seen that more of our seniors have identified being more isolated. And when folks are isolated, the chances of them wanting to make meals that are beyond serving one, right? They may not have access to transportation. They may live in a more rural site. We do know that individuals that live in a more rural county are more at risk for food insecurity. Feeding America has actually found that the top 10% of counties nationwide that are considered food insecure are actually rural counties. So seniors that are living in those areas, as well as other health conditions that just impact the quality of life and maybe not wanting to eat as much, right? Or going to the grocery store, feeling actively good enough to be trying to get access to food or accessing those programs that can support food secure families.
So what do you recommend for the person that's listening to this and they feel like, you know, this is impacting them and their mental health? How do you recommend they get help?
Yeah, there's a lot of opportunities out there. So our local ADRCs, the Aging Disability Resource Centers, can be found in many of our counties, and they often will have senior dining centers across the county that folks can access. And so ADRCs often have access to transportation for our seniors as well to get there. Home delivery services can be really a great option for some of our seniors living alone that might not have the cooking skills or may not want to be preparing their own food. And just want that extra support with someone bringing it to them to find that connection there as well. So I think those are the biggest programs that are out there. The SNAP program as well is a wonderful program to get healthy foods to, again, often we associate SNAP with just our low-income families, but really SNAP can support our senior population as well, and it is income-based. And so if you would qualify or you know a senior that might qualify for that, I always recommend that program.
You certainly want to preserve someone's dignity, and you know, and it can be a sensitive topic. How can the community help if they feel like they know someone who is going through this?
Yeah, I think isolation can be a really hard thing, and I also believe that, yes, accessing your food pantries, there's often been a stigma behind being food insecure, and how do we just create more of a norm around this, that it's okay to get access to the foods that you need, and having communities band together and provide that support, whether that's by volunteering at a local program that does senior transportation, or I've seen senior cross-generational volunteer programs where seniors are in schools working with students. Okay. And just building relationship, I think, is the #1 thing we can do.
Okay, all right. Thank you so much, Megan, for being here. We really appreciate your help.
Thank you.